Good afternoon, guys. Now, this afternoon's topic B is long COVID leg symptoms. So, I'm going to discuss that for you for B. So, let's get going. Okay, shall we? Long COVID can cause persistent leg symptoms ranging from diffuse muscle aches and weakness to neuropathic pain and circulatory problems. If symptoms are severe, new, or worsening, see a healthcare professional promptly. Long COVID, formerly post acute sequels of SARS CoV 2 infection, PASC, is not a single condition. Is not a single condition, but a constellation of lingering biological disruptions that can persist 12 weeks or more after infection, while fatigue, breathlessness, and cognitive fog often uh, dominate public conversation. Many people find that the most disabling part of long COVID lives in their legs. It can begin subtly, a heaviness that makes stairs feel steeper, a burning sensation that flickers along the shins, or a deep ache that feels eerily like the worst day of the flu. For others, like leg symptoms arrive suddenly, sharp pain, numbness, numb patches, or a sense that the legs simply won't hold. These symptoms can be episodic or consistent. They they and they often intertwine with broader long COVID features, such as post external malaise, sleep disruption, and autonomic instability. Underlying mechanisms. Long COVID leg symptoms rarely stem from a single cause. Instead, they emerge from interlocking biological processes affecting muscles, nerves, blood vessels, and overall conditioning. Persistent inflammation and immune dysregulation, even months after infection. Some individuals show signs of immune activation, elevated cytokines, and inflammatory mediators can disrupt muscle metabolism, producing deep flu-like aches, early fatigue, and the sense that the legs give out faster than expected. Neuropathic injury. COVID has been linked to small fiber neuropathy, affecting the tiny nerve fibers responsible for pain and temperature sensation. This can create burning, pain, tingling, numb patches, or sudden electric shock jolts. In some cases, nerve irritation stems from immune related inflammation rather than permanent damage. Microvascular and endothelial changes. SARS CoV 2 can injure the endothelium, impair, impair, uh, impairing blood flow and oxygen delivery. People may notice cold legs, molted skin, or heaviness when standing, especially if autonomic dysfunction is also present. Microclots documented in some long COVID studies may further disrupt circulation, decoding, and musculoskeletal change. Even short periods of inactivity during acute illness can lead to muscle atrophy, tightness, and reduced endurance. Long COVID's hallmark fatigue and exertion tolerance can prolong inactivity, creating a cycle where the legs feel weaker, stiffer, and more prone to cramping. Typical symptom patterns. Leg symptoms in long COVID often fall into recognizable patterns through many people's experience. A blend. Diffuse bilateral aching or heaviness. Often described as walking through wet cement. This pattern aligns with post-viral myalgia mitochondrial stress or decoding symptoms may worsen after even mild exertion. Focal burning, stabbing, or numb patches. These sensations point toward neuropathic involvement. They may migrate, fluctuate, or intensify with fatigue, heat, or prolonged standing. Symptoms tied to posture or heart rate changes. When leg discomfort worsens upon standing or is accompanied by palpitations. Dizziness or temperature changes. Autonomic dysfunction, especially POTS. May be involved. Blood pooling in the legs can create heaviness, pain, or a sense of instability. Cramping, tightness, or reduced endurance. These symptoms often reflect musculoskeletal changes or deconditioning, especially in people who were bedbound or significantly less active during and after infection. When to seek medical care. Most long COVID leg symptoms are uncomfortable rather than dangerous, but certain signs require prompt medical evaluation. One-sided swelling, sudden severe leg pain, warmth or redness of a limb, shortness of breath accompanying leg pain, progressive weakness that limits walking or balance. These symptoms may indicate deep vein thrombosis, nerve compression, or other complications that need urgent assessment. Management principles. Care for long COVID leg symptoms is individualized and often multidisciplinary. Assessment first. Clinicians may evaluate circulation, nerve function, muscle strength, and autonomic signs. Tests can help rule out clotting disorders, neuropathies, or structural problems. Symptom detected care. Graded paced rehabilitation for deconditioning. Energy conservation strategies for post-exertional malaise. Approaches used for neuropathic pain when appropriate. Vascular or autonomic management strategies when circulation or POTS-like symptoms are present. Multidisciplinary follow-up. Many patients benefit from coordinated care involving primary care, neurology, cardiology, autonomic specialists, and physical therapy. Leg pain after COVID is real, common and biologically plausible. It can arise from muscle inflammation, nerve dysfunction, vascular changes, or this deconditioning, and often from several of these at once. Most people improve gradually, but persistent, isometric, or severe symptoms deserve medical attention. To rule out treatable complications. Okay, guys, that's your B for now. I'm going to take a little break. I'll be back on shortly for another show. For now, Gator Wellness, take care, folks.